Hi, I'm Naomi Shifman, and today I'll be presenting on the field of psychedelics, gaps, and directions forward. I have my bachelor's in neuropsychology, focusing on psychedelic public health and policy, and I chose this topic today as I am an advocate for drug policy reform and ending the war on drugs. I hope to bring about effective policy change to the field of psychedelics. Over the past several years, there has been a resurgence of interest in psychedelics, primarily for their therapeutic and personal well-being potential, which has been driven by the increase in research on the therapeutic effects of psychedelics, such as psilocybin and MDMA. From this resurgence, various drug policy reforms for psychedelics are beginning to occur at the state and local level, such as decriminalization, though psychedelics remain federally illegal. Psychedelic assisted therapy refers to the practice in which a patient consumes a psychedelic substance as part of a psychotherapy program for the treatment of a health condition. Psychedelic therapy is currently accessed through clinical trials, and outside of trials, psychedelics are accessed for healing through select state-regulated service centers, where facilitators supervise the psychedelic experience but are not permitted to treat a medical diagnosis. Psychedelics are also accessed through ketamine clinics, and while not a true psychedelic, ketamine is used off-label to treat depression due to its less restrictive Schedule III status. This renewed interest in psychedelics has led to the emergence of a new multi-billion-dollar industry. The increase in private funding and pharmaceutical interest raises concerns about the rapid expansion of medicalization and commercialization of psychedelics. Given the rapidly growing interest in psychedelics, the industry is poised for policy reform. However, the field of psychedelics has yet to proactively address emerging issues in equity, drug policy, and safety. Failure to properly address them may perpetuate social and health inequities and threaten the future viability of the industry. Examples of social inequities include incarceration or the exclusion and exploitation of historically marginalized communities. Examples of health inequities include access and affordability disparities. Safety risks can also occur, such as boundary violations or misinformed psychedelic users. Failure to address issues may also restrict research, which could exacerbate these risks and inequities. To bring attention to pressing issues in the field, I created an issue brief that concisely identifies gaps and areas of improvement to inform future directions in the field of psychedelics as it relates to equity, drug policy, and safety. Rather than a policy brief, which provides policy recommendations for an issue, I'm doing an issue brief which identifies and defines the issues and their policy implications. Stakeholders for this brief include regulators, legislators, industry professionals, and advocates. While engaging in the field through reading various news articles, social media posts, and networking at conferences, the more I realize the complexity of the issues and that the public and newcomers to the field are often unaware of the issues. My background in advocacy for drug policy reform through Students for Sensible Drug Policy led me to this project to increase awareness of gaps in the field to help bring about policy change. For this project, I conducted qualitative, semi-structured interviews with industry professionals on emerging issues in the psychedelic space to establish themes. These industry professionals came from various backgrounds such as counseling, business, policy, and ethics. I also did a literature search to collect articles to write the background of my issue brief. I then conducted qualitative coding and thematic analysis on my interview data and wrote up my findings into an issue brief. And what emerged from my research were problematic trends that I then condensed into 5 gaps in the field of psychedelics: legalization and regulation, equity and access, ethics and oversight, psychedelic education, and the psychedelic community. And each are broken down into subthemes. The gaps in psychedelic legalization and regulation are illustrated by a complex landscape of varied legal and regulatory policies, diverse concerns and perspectives regarding regulation, and the intricacies of the emerging profession of psychedelic facilitators. Challenges in achieving equity and access in the psychedelic space are multifaceted, including financial, legal, and policy-related barriers. Gaps here relate to defining equity and impact in the context of psychedelics. Impact here relates to the effect of the war on drugs and restorative justice programs. Gaps also include economic issues, varied opinions on decriminalization as a means of equitable access, and issues with the inclusion of historically marginalized communities in policymaking. Gaps in psychedelic ethics and oversight are highlighted by concerns and need for ethical standards and robust safeguards in psychedelic practice. The theme of psychedelic education includes gaps relating to education and awareness on psychedelic use and deficiencies with current drug education policies. Psychedelic community is a diverse space made up of individuals from varying fields, backgrounds, and goals. And the psychedelic space faces several issues related to community organizing, achieving consensus, legislative advocacy, and navigating differing perspectives. But within these fairly organized gaps are even more subthemes. And as I conducted my research, I continued to find more ways of breaking down these problems and how it's not just simply 5 gaps. This graph illustrates the deeper level of these gaps and how, through my research, I gained a better understanding of the intricacy and depth of the issues. For instance, psychedelic education challenges. As psychedelics become more mainstream, comprehensive education about these substances is crucial, as there are significant gaps in knowledge and awareness surrounding psychedelics. With education and awareness gaps, it's not only about addressing stigma or the lack of knowing about psychedelics, it's also understanding the demographics, contexts, and sources of these knowledge gaps. For instance, providers may have gaps in their training on ethical responsibilities, and amongst both providers and users, there may be misconceptions about psychedelics, such as the beliefs in instant psychological healing, contributing to unrealistic expectations and misinformation. These issues are compounded by limited access to accurate information, particularly among new psychedelic users. And without reliable resources or post-trip support, individuals may face unsafe experiences and lasting challenges. With psychedelic education policy, it's not just about having these policies, but understanding the need for educational reform, funding initiatives, how reform will be implemented, and systemic barriers to evidence-based drug education. Existing education frameworks following the legacy of DARE fail to meaningfully reflect current understandings of psychedelics, leading to uneducated use. A significant challenge to drug education policy reform is the lack of investment in public education on drug use. The landscape of psychedelics is marked by significant challenges related to equity and access. The emerging industry of psychedelics raises questions about who will get access to these substances, which communities will benefit from legalization, and the implementation of equity into policymaking. Issues related to economic and legal accessibility, social inequities experienced by historically marginalized communities, and implementing equity initiatives and regenerative programs must all be addressed. This involves recognizing the lack of financial support outside of private funding to create effective access pathways, recognizing the deficiencies with the inclusion and involvement of historically and intentionally excluded communities, including Indigenous groups, and recognizing that designing psychedelic equity and access initiatives may be complicated by how the field and legislative initiatives choose to address personal use. Additionally, there's the challenge of defining equity in the context of psychedelics, as it will likely differ from other fields such as cannabis, as psychedelics differ in terms of the history, scale, and communities affected by the enforcement of prohibition policies. This ambiguity in defining equity and impact for psychedelics complicates the task of creating equity programs that effectively address historical injustices related to psychedelic prohibition. The rapid movement of policy reform for psychedelic substances and advocacy efforts to reschedule psychedelics also raises questions about potential legalization and regulatory frameworks and their implications. The current landscape of psychedelic legalization and regulation is seen as complex and potentially burdensome, with political challenges that can influence legislative and policy development. The regulatory environment is characterized by the variability in regulations as different states develop their own policies for decriminalization or state-regulated psychedelic medicine programs. These variations in state-level policies may create a fragmented regulatory landscape with significant differences in cost, accessibility, and practice operations. The development and implementation of psychedelic policies face several challenges due to differing approaches and nuances involved in the legislative process. While legislation is occurring at the state level, the field is also increasingly pushing for FDA approval. Another complication is that the legislative approach to psychedelics varies significantly due to the complexities of drug classification for psychedelic substances. Psychedelic regulation may be further complicated by the professional and legal ambiguities surrounding psychedelic facilitators. And in my interviews, interviewees emphasize the need for regulation to ensure safety and access while acknowledging the difficulty of designing inclusive policies. Participants express concerns about overregulation, government involvement, and restrictions on personal autonomy. There are also fears about over-medicalization, commercialization, and monopolization that has the risk to maintain criminalization and limit access to safe supply, as well as prioritizing profit over equity and social justice. But all these gaps that I've just gone over are not just individual sections. It's even more complicated than that because all these issues are interconnected. And this graph highlights that psychedelics is a complex, evolving landscape where all these challenges are interconnected, and so one change to any of these can affect another and have unintended consequences. For instance, as psychedelic use becomes more mainstream and challenges in providing safe and equitable access arise, there are concerns that legislative initiatives will not make considerations for personal use, thus adding to existing equity issues such as access and enforcement disparities. While legalization or decriminalization of personal use may help to address this challenge, there are concerns about extensive education and awareness gaps surrounding psychedelics that may leave individuals vulnerable. These gaps are exacerbated by issues in current drug education policies and a lack of educational reform, thus adding to stigma and misinformation. And so legislation that does not take into account personal use and does not include a structured approach to public education may lead to unintended consequences related to safety risks, social justice inequities, and health inequities. And so it's very messy and it's complicated, and this is why I'm doing an issue brief, because I believe how can we begin solving these issues if we don't have a clear understanding of what they are, how they're connected, and how they feed back into each other. But I think there is hope for the future, and future is another theme that came up in my interviews. In my interviews, participants envision the future of psychedelics as one that is accessible, inclusive, safe, and community-oriented, driven by innovative policies, diverse practices, and a commitment to ethical standards. The four main areas for the future are innovation in policy and research. There's a push to reimagine drug policy and research through innovative frameworks that prioritize safety, inclusivity, education, and the recognition of diverse applications and cultural contexts. Enhanced regulation and licensing. There's a vision for a psychedelic space that has some structured oversight while allowing for flexibility and community input. Diverse treatment and access approaches. There's a desire for a flexible and inclusive approach to psychedelics that embrace diverse experiences, settings, and treatment modalities beyond traditional clinical models. There's also advocacy for improving accessibility and inclusivity in psychedelics, with an emphasis on financial support, cultural competence, diverse representation, personal autonomy, and alternative access pathways. The vision of the future of psychedelics echoes the complexity of the issues and how there aren't simple solutions. But future outcomes are not isolated from these issues, and this graph shows the complex interplay of factors that can influence our future. The future of psychedelics will be dependent on if we address these issues and how we address them. Additionally, the future we end up creating can present new challenges and shape the landscape of psychedelics in terms of equity, policy, safety, education, and community action. If the psychedelic field desires a future that is accessible, ethical, safe, and equitable, then we must remain cognizant of unintended consequences of changes to the field due to interconnectedness of the issues. And I believe the psychedelic movement can work towards a better future. With the momentum psychedelics currently has, this is a good time for the field to really look at the big picture. Now, I don't have all the answers, but the intention of my issue brief isn't to solve the problems, it's to highlight them and provide a roadmap for stakeholders to begin creating solutions. So let's talk about what we can do right now. My recommendations include education. Stakeholders must be educated on issues in the psychedelic field, their interconnectedness, and unintended consequences. The psychedelic community must be aware of the issues as well to ensure developments in the field do not further complicate existing challenges. Through this education, the psychedelic community can ensure policymakers are properly aware of the issues and need for balanced policies. Additionally, there needs to be increased efforts to educate the general public and newcomers to the field on responsible use and risks to address issues of stigma and misunderstanding. Consensus and collaboration. Though division and disagreement are inevitable, common ground within the psychedelic field must be found to move the field forward. Additionally, common ground is needed to foster productive collaboration. Consensus and collaboration are paths to unity in the field and can help bring about innovation. By looking at areas of interconnectedness, different groups within psychedelics can begin finding consensus. Collaboration efforts can be aided by interdisciplinary work by including individuals from various backgrounds and disciplines. Collaboration with other drug policy groups such as cannabis or harm reduction is also needed, as we are all affected by the war on drugs. Advocacy efforts to reform drug policy can be strengthened through these collaborations. Thirdly, innovation and policy and research. Due to the intersectionality of issues in the field, we must reimagine drug policy and research through innovative frameworks that prioritize safety, inclusivity, education, and the recognition of diverse applications and cultural contexts. Policy will need to be interdisciplinary to reflect the diversity and complexity of the psychedelic field. And lastly, active community involvement. The psychedelic field must ensure to include communities that will be most affected by unintended consequences, such as indigenous communities, other historically marginalized populations, and underground psychedelic communities. These communities have been historically excluded from conversations in mainstream psychedelics despite their significant contributions. The field must ensure to ethically and intentionally include communities in collaboration, advising, and decision-making efforts. With the recent FDA denial of MDMA therapy for PTSD and the increasing number of states establishing psilocybin programs, now is the time for the psychedelic field to come together on addressing these issues to set us up for success. Thank you.